Welcome to another Baby Brunch video as well as a podcast. Today, we're meeting Dr. Tema. He's a medical doctor that has specialized in psychiatry and further specialized in child and adolescent psychiatry. He's got extensive experience in both local as well as private mental health care. And today, we're unpacking some questions that you have sent us and that we are basically interested in. So, Dr. Tema, welcome to Parent and Baby Brunch.
Thank you so much. Maybe let me just get out of my being starstruck and enjoy the moment. But also just to appreciate you putting mental health of children on the spotlight again.
Doctor, it's the one thing to understand basic things. Like in my home, when I ask my 7-year-old, how was your day? She says, it was good, tiring, exhausting, silly, fun, sad. You know, we are able to describe the emotions and how the day was. But not everyone understands when sad becomes depression, or even when it becomes something that we need to be aware of in a different space. So, I'm going to get back to the basics. What do symptoms look like? When do us as parents become aware that our children, teenagers, might be struggling with mental health? Let's just, for the sake, issues. Let's call them issues. How do we know that we are struggling?
So, I want us to cover child psychiatry as from both, your young children through to adolescent psychiatry. And the reason I'm saying that is, your younger children are less expressive. If you're very lucky, your teenagers would be reasonably expressive. But largely, I think you take cue from the children's behaviors.
Right.
For example, So, for example, struggles with sleep or appetite, or if they are in school, there might be difficulties in terms of the grades deteriorating, but teachers might also report on some disruptive behaviors as well.
Now, disruptive is another word. I'm unsure. Some say naughty, some say disruptive, some goes, but children are disruptive. That's what they're supposed to be, you know. When do we classify behavior as disruptive?
So disruptive in a family home, disruptive is when a child gets into trouble a lot with the parents. For example, if there's discipline being trying to be managed and the child is not responding to discipline, that in itself is a disruptive behavior. In a school setting, disruptive is when a child is clearly disrupting other kids and also disrupting their own ability to learn in the space that they are in. And in school, the teachers find it easy because they have the comparison of the other children at similar developmental age.
Right.
Yeah. Whereas at home, you just have your child, but really is that sense that, sure, I'm really struggling to discipline my child. There's going to be something a little bit more to this than just a child being naughty.
How do we know that how do we even diagnose it?
So I do think if you're looking at the causes of mental illness in children, there's usually not one specific cause. And so we look at mainly what we'd call risk factors. And the risk factors can be like from when the child was born or during pregnancy, and the child and during pregnancy, it might be the mom was exposed to cigarettes or alcohol. Maybe they didn't know by that time that they were pregnant, for example. And then it can also go into after they're born, difficulties in the family where the parents are in discord. Children pick those things up because they are quite perceptive. But there are those that are genetic, for example, and children would be born with that kind of vulnerability. So it will say risk factors or causes of the mental illness in children are quite broad. And so usually you go with context when they are presenting.
How do we get diagnosed? I mean, where do we start? You find that there's difficulty and that you need to go on this journey of understanding self, understanding child or teenager. Where do we start? Does it start with GP? Do psychology and psychiatry go hand in hand? Do you consult? Is it one direction? How do we start the diagnosis or the process or this journey?
So I quite like what you say in terms of the people that you're mentioning. I think the main thing is entry into access. So whether you get through through a GP, a lot of GPs are quite aware of mental health in children. And I think, from the medical doctor's point of view, is if a child says, yo, I'm worried, there's something wrong with my child, or there's something I'm concerned about, even if as a doctor you're not aware, it almost jolts you to look a little bit deeper than what you thought you saw. But entry can be through anyone. I have to speak for child psychiatrists because no one wants to come to us at the first glance, but like psychologists, nurses, GPs, childcare workers, and I will tell you, most referrals are through teachers to any of those clinicians that you have mentioned now.
I want to get to a scenario where I have interviewed two moms privately before we were in discussion today, and the one, the father is on medication and it's helping him, and now the child is on medication and it's helping him, and that the dad tried to explain to me, and he said to me, Ilana, when you are diagnosed and on medication, he says, I feel so much better. He said to me. He says, I'm relieved. I feel so much better. And another scenario, when I spoke to the mom, she said, when he's in school, we do what they say. And then when he's on holiday, we take him off these things because we don't really want him to be on this medicine.
Yeah.
And so in both scenarios, I empathize with family who feels better and who takes your advice. And then on the other side, they're not ready. They don't want to take this diagnosis into their stride. What advice do you have for us with what is busy happening in both scenarios?
So I want to explain, and I think maybe it's probably best we label a diagnosis, right? So for example, something like ADHD or attention deficit hyperactivity disorder. I think in the first scenario, for example, if a child is on medication, it just makes it easier for the child to do work. It makes it very easy for the child to socialize with peers, because that's where they need to learn the social interaction. It makes also family functioning quite easy. So in the second scenario, for example, where the parents would choose to take the children off medication during school holidays, that consistency that the child had over time as they were on medication is lost. And so you're losing the routine, but also you're sending a message which is really quite, sublime, in that you're saying medication is not important during other times. But what the child is also reading is that medication is not important. And as they grow older, for example, when they're teenagers, they then challenge the notion of needing to take medication so they are able to function. So my sense is a child that has got ADHD is going to be on medication every day. The exception would be when we're struggling with side effects that are intolerable or we cannot do anything about. And side effects are present, but there's things that we can do about that. But so my advice is that unless we really, really are struggling with side effects, it helps the child to feel the same every day, in sense that having medication every day. Yeah.
When you talk psychiatry or children, misbehaving in class, all these words, they make me so sad. You also hear Ritalin, I'm not putting my child on Ritalin. Why does psychiatry have a bad taste?
Especially in children, child psychiatry is quite complex in children because most of them present with multiple problems. A child that presents with ADHD, attention deficit hyperactivity disorder, will probably also present with anxiety or depression,
right,
or they will present with learning problems. So when you treat the one problem, the other is unmasked. And so it doesn't necessarily mean that medication has caused the other problem.
Right.
It just says we've treated the backdrop, the background noise, and now some of the problems that we have had are much more clearer. So that is the argument that I try and present to the families. And like, people have had horrible experiences with medication. I'm not in any way minimizing that, but it's not. I think people need to also sort of take that with a pinch of salt, that if somebody is taking, like I'm saying, if you're taking, for example, medication for ADHD, if you're skipping doses, you will have horrible side effects when your body gets used to the medication. You might have horrible side effects if the dose is high and you skip. Do you understand? And that kind of context is never really clearly described in these stories where they give psychiatry or psychiatric medication a bad rap.
Doctor, this has been valuable, and I wish you a great time in meeting all of our little people, our teenagers, as well as our parents. And I really pray, please God, may you always be blessed with the right assessments and treatments so that you can help save many, many lives and help a lot of people. Thank you.
Thank you very much for the opportunity as well, Ella.